What is acne and what causes it? Acne is one of the most common skin diseases that can come on the face, the chest, and the back. It is usually multifactorial in its cause, and I think of it as an individual who is genetically susceptible to acne can develop acne with hormone changes. Like I said, 80 to 90% of patients in their adolescent years can get acne, and sometimes lifestyle factors can play a role as well. Who typically gets acne and when is it most common? I think of acne as affecting young people, 80 to 90% of young people actually, so very prevalent. But a little less known is the fact that 50% of adults can struggle with acne. How can acne present differently in patients of skin of color? This is a very important question because we do know in skin of color, the inflammatory component of many skin diseases is harder to appreciate. And when we have acne, especially inflammatory acne, cystic acne, that redness from the inflammation of those lesions are harder to appreciate. And so it is very important that we do a careful examination, and also my personal threshold for treating skin of color when it comes to acne is much lower to use therapeutics that can prevent long-term sequelae. And we do know as well in skin of color, there is a higher incidence of things like hypertrophic scarring or keloid scarring. Another reason why to treat early and treat more aggressively to prevent long-term scarring and sequelae. When we look at skin of color, what we call post-inflammatory dyspigmentation, it's much more cosmetically bothersome. It has a higher impact on patients' quality of life. And that is another reason why when we see patients with skin of color is to treat early and treat aggressively, because sometimes the sequelae such as post-inflammatory dyspigmentation it's gonna take a lot longer to resolve and potentially, harder and more stubborn to treat, say, compared to a patient who's Caucasian. And so, when it comes to considerations in treating skin of color, I think it's treat early, treat aggressively to avoid that long-term post-inflammatory hyperpigmentation that can linger on, and also to prevent that hypertrophic and keloid scarring, which we see more commonly in skin of color as well. How do we approach treatment of acne scarring? And this is where your physician can be quite helpful, because you do need to do a thorough exam and get a sense of, is it scarring in the sense that it's post-inflammatory pigmentary changes? Is it post-inflammatory erythema, which we can see linger on for a while as well? Or is it actual disruption of collagen in the skin, collagen bundles? And once you tease that out, and a certain patient can have a combination of all the above, that's what will guide your approach and your algorithm to treating acne scarring. So for example, post-inflammatory erythema, which is redness, post-inflammatory hyperpigmentation, which is the dark spots that are left behind from previous acne lesions. The mainstay really is photoprotection. A lot of the time, you can argue tinted photoprotection. And then sometimes people do rely on what I call over-the-counter cosmeceuticals or dermocosmetics that contain things like niacinamide, right? When you are waiting, for example, to see your doctor, those are conservative things you can do. So some protection and potentially some over-the-counter anti-inflammatories for the inflammatory component. But I still think the key really is to treat the acne so that you're not left behind with treating the consequences of the acne. And so the key is really prevention and targeting active acne. But if the scars are already there, is it pigmentary changes? Is it redness? Targeting those. Is it actually, old acne scarring from decades ago and you're seeing, collagen disruption in the skin, and those are, broken down into different types of scars, and we have different treatment approaches for ice pick scars, rolling scars, boxcar scars. There is a whole area of research looking at, how do we approach acne scarring, and there's so many different subtypes of acne scars, and this is where that medical expertise really comes in to go see your dermatologist, someone that you trust to take care of your skin, because the approach is different. What are the differences between over-the-counter and prescription treatments? Over-the-counter products are accessible, so that is a huge plus in my opinion, and there are some very good over-the-counter products that have active ingredients targeting acne, such as benzoyl peroxide, salicylic acid. And I do think over-the-counter products have a role to play for mild acne, and if you respond to over-the-counter products well, then great. The other nice thing about over-the-counter products is that they can be a nice complement to your prescription products. So prescription medications in acne usually are well, as the name suggests, they're prescribed by your physician. They are less accessible because you do need to see a doctor before you can, a doctor or a nurse practitioner before you can get on these treatments. However, they tend to be more efficacious, I want to say, especially if you have moderate to severe acne that over-the-counter products are not helping with, or helping little with. And so prescription products can be topical, can be oral, and they are different big categories of prescription products. So topicals that are topical retinoids, topical antibiotics in combination with retinoids or benzoyl peroxide. We now have triple combination of all three. We also have topical agents that target that hormonal component of acne. So we're very, very fortunate to have numerous prescription options for topicals. On the oral side or systemic treatments for, low dose oral antibiotics, we think about, of course, oral isotretinoin, and then, the oral contraceptive pill, various products that all help, again, address the hormonal component that we see in a subset of patients. So all of these can be effective. These can also be combined with over-the-counter products, and it's about finding the right combination that works for your skin type and what you can tolerate. If you're struggling with acne and you've already, tried some of the over-the-counter products and you're really at that stage where you're like, is it what I'm eating? Is it my hygiene? All of these things, again, I would encourage these patients to seek out their physician, seek out their dermatologist, or visit the Canadian Dermatology Association website to get credible evidence-based approach to treating their acne. And I think, acne patients should not be suffering from their acne chronically. There is help. We do have tools, and there are evidence-based treatment approaches to acne.